Hi guys, this question came in recently on our weekly Q&A here on Instagram. If you are unfamiliar, 40% of our client list are Dalmatians, many of which are HUA Dalmatians, so we deal with this condition quite frequently. Now, this is one of the more uncommon ailments for HUA dogs. Typically, we are dealing with a high uric acid, meaning the pH is extremely acidic. Every once in a while, there's an HUA dog that is dealing with a base pH, and this could be from the allopurinol or a variety of other factors. So we need to be particularly careful, and I do recommend getting one-on-one help. We need to continue to monitor the amount of purines that are in the diet per 100 grams of food, because this is what's going to help prevent those urate uroliths from forming in the bladder. However, we then need to look at the potential renal acid load of the foods that we're feeding and use that to manipulate the bladder pH. Bladder pHs of an 8 or higher are at risk for getting UTIs, and different crystals can form then from the bacteria in the bladder from a UTI. Potential renal acid load of different foods, and we're going to be using some of those to manipulate the bladder pH. However, since HUA dogs pump an excess of high uric acid, it's also really important that while we are trying to manipulate the bladder pH, we are monitoring how that bladder pH looks on a daily basis, and not just on a daily basis, but how it looks throughout the day, because it's going to change. The morning is always going to be the most concentrated. You're going to want to test it afternoon and evening, and you want to rotate those times to get an overall good view of how your dog's diet, therapies that you are trying to use are working for your pet's pH. You're comfortable with testing their bladder pH at home with pH strips. There's a test cup that you can get that has a handle on it so that you can collect the urine sample. Now, I'm not telling you to stop going to the vet. You still need to do your regular urinalysis and ultrasounds, but you do need to be testing that bladder pH from home in between these appointments to make sure that it's not getting more acidic than we want it to or more base than we want it to. All right, guys, I hope that helps.